Hello, my name is Tracy Novander, and I'm doing my presentation over Bartonella henselae. The basics of this bacterium is they are structured small, rod-shaped, gram-negative rod, non-sporing, non-capsulated, and they consist of cell wall, cell membrane, cytoplasm, genetic material, and flagella and pili. The virulence we're going to go over specifically in the next slide, but that's going to consist of your adhesins, your invasions, type 4 secretions, immunomodulation, and biofilm formation. There's no known toxicities to the virus, although it does cause cat scratch fever, specifically in children. In extreme cases, it can cause enlargement of the spleen and liver, and it can also cause infection in the heart valves. The pathophysiology of this bacterium and its interference. The adhesion and the invasion allows the surface to adhere to the host cells. The T4SS injects the bacteria specifically into the host cells, and this injecting of the protein interferes with the signaling pathways, which causes the immune response not to be so effective, and it makes the bacteria able to conduct and to survive. The survival of this bacteria is capable of surviving in the endothelium cells. And that's where it'll invade and resist all the immune responses. After expression of the immune factors, the immune modulation comes in and invades the host's defense. So that makes the host defenseless to protecting itself from the bacterium. The biofilm formation is basically where they stick to each other and they make the formation of the bacteria, create a wall basically, and it protects from immune responses and the antibiotics from coming in and destroying the bacteria. The population it affects is nowhere specific, it's more worldwide. Here in the United States, it's going to be in the southeast region, typically in warmer, humid climates, because that's where the bacteria is going to be more able to survive, to grow, and spread. And it's only going to spread through cats, so wherever cats are at is probably where the disease is going to be at, especially strays, but it can be in domestics as well. It mainly affects children. I haven't personally met anyone or during my research found anyone that was really an adult getting it, so mainly children under 15. Also the veterinarian clinics and animal shelters, considering they deal with animals daily, on a daily basis, and they deal with strays as well, so it makes them more susceptible to receiving the disease or being around the infection. So in order to take preventative measures, we need to make the community aware, make the public aware, our family members, children especially. We need to pose them the health risks, all the infection it can cause, the immune response that might happen. You'll realize you can get a cat scratch from an infected cat, or a flea bite from an infected cat or flea, and it'll take 2 to 3 weeks for the symptoms, or 1 to 3 weeks for the symptoms to actually show up. There'll be a little marking around the scratch, and it'll grow a little bit, and you'll get swollen lymph nodes and a low-grade fever. And for people that are immune compromised, more serious and severe symptoms can happen, especially people on chemotherapy, or they're waiting an organ transplant, or they're HIV/AIDS positive. So we need to also make everyone understand that the procedure with the cats, what we need to do, what preventative measures we need to take, which we'll cover on the next slide or the slides to come. The treatment that we need to take, and training that we might need to show people how to interact with cats. Also, Just investigating the microbiology of the infection can be very useful because you can find out different ways it can help, to have different tools to help, or medical practices that can help prevent or treat this specific disease. Speaking of treatment, there are two common uses, and it's going to be the two antibiotics. Azithromycin, that's going to be your 5-day course of antibiotics, and then your doxycycline, which is your 14 to 21 day course. In extreme cases where maybe your body is resistant to those two antibiotics, you're going to take the ciprofloxacin, and that's going to be also for people maybe that are allergic to those antibiotics, or they need more severe treatment, like the immunocompromised possibly. Also, you're going to want to treat your pain. If you're having any pain with the symptoms, and probably just take an over-the-counter NSAID. Good prevention is going to be practicing good hand hygiene, washing your hands thoroughly, especially if you're playing with cats or kittens or around domestic or stray animals you're not very sure carry the bacteria or not. You're going to want to avoid touching your face, your nose, your mouth, especially after touching the cats. Not rough playing with the cats, because rough playing with them can cause them to scratch or bite you and infect you with their bacteria. You can do protective clothing, long sleeves, pants, to prevent scratches from going through. Flea control methods, you can, flea bomb your house or apartment, or, undergo treatment of fleas on your animal to make sure that the flea bite doesn't transmit the infection as well. Avoiding strays would probably be good. And don't let cats lick open wounds, like bites or scratches or anything like that, because that's another way of transmitting the bacteria. So another way to prevent is to raise awareness, like we said, through your community, through your friends and family, family members, household members, especially if you're getting a new kitten or a cat in the house, and educate them about what could happen and what symptoms to look for, and to seek medical attention if you do start seeing those symptoms, as the swollen lymph nodes and fever and the bitten area to be a little inflamed. And that's going to be it. Thank you, and I hope everyone else's presentation went well.